Hello, my name is Rosetta Degbe. My group members name Shidi Duro, Georges Fries, Shidi Obiageli, Ijeoma Ogbonia. The title of our presentation is Communication Vulnerability in Patient Care. We have a scenario about a 56-year-old widow Vietnamese woman who has been a patient of Dr. White for 1 year. She speaks very limited English. She reported she did not speak any English when she came to the United States 20 years ago. She has 2 children who also, like her, speak limited English. She is a warehouse worker. She has hypertension and diabetes, currently on medication with good blood pressure and blood sugar control. She reported that she's exercising 2 to 3 times a week and observing a healthy diet. She lives in the part of the city predominantly dominated by Vietnamese. She is interacting mainly with a Vietnamese community, both at work and Baptist church. Dr. White never used an interpreter since Mrs. Mogg has been under his care. He assumed that since she speaks some English that she understands him. Mrs. Mogg most of the time nods her head at Dr. White when he speaks to her. So he assumed she understands him. He never bothered to ask her if she really understands or if she needs a Vietnamese interpreter. Mrs. Mogg on some occasion came to the clinic with her children. Little did anyone know they all came because they were trying to figure out or understand Dr. White. They never tried to notify Dr. White that they were having great difficulty understanding or following his instructions. Little did the doctor know that Mrs. Mogg and her family always went home to consult another Vietnamese nurse who works in the ICU in another hospital. And now the story had some implications. Dr. White assumed everything was okay because Mrs. Mogg never complained and her blood sugar and her blood pressure has been well controlled. Most of all, Mogg always nodded her head when Dr. White is speaking. So Dr. White assumed she understood and followed his clinical care and instructions. Language issues. Mogg understands and speaks some English, but her primary language is Vietnamese. Hospital staff spoke only English. Communication vulnerability. Dr. White did not realize that Mrs. Mogg did not understand all his teaching and instructions and did not know she has been consulting a Vietnamese nurse. Dr. White never really asked Mrs. Mogg if she needed a Vietnamese translator. Mogg never told the doctor that she needed an interpreter. Some of the relevant domain. The story clearly indicated that Dr. White had a patient-provider communication problem and did not apply proper patient care or patient-family engagement. Ineffective communication with patient and provider share decision-making and trust can potentially affect the quality of care, regardless of the patient ethnicity. Patient-centered care focuses on the patient as an individual, with the goals to empower patients to be an active participant in their care, including shared decision-making with providers, patient, and family. This is a preferred way of making a medical decision. High-quality doctor-patient communication shows better results in the quality of the patient's life. Lack of patient-centered care may disproportionately affect vulnerable population. In the year 2000, the census shows approximately 47 million individuals in the United States speak another language other than English at home, and over 21 million have limited English proficiencies. Research also shows that patients have worse access to care and gives poorer rating of their care than English-speaking patients. This scenario depicted how lack of communication between patient and provider can compromise the delivery of care. In this case, both the patient and the provider bear some responsibilities for what took place. The physician had a duty to ensure the patient understood the plan of care before he or she left the facility. The patient failed to let the physician know that she did not understand the information that was being shared. According to Igor Mays, language barrier contribute to discrepancy in provider-patient communication in Asian American with limited English proficiency and may lead to unmet healthcare needs. Communication during medical interaction plays a central role in decision about subsequent interaction, as it can influence patient adherence, satisfaction with care, and healthcare outcome. Good communication helps establish mutual respect and trust, which increases the likelihood that patients will take an action role in the management of their care. Improved communication between patient and provider encourages patient to clarify complicated issues, adhering to complex treatment regimen, and assist them in making better health choices. Asian Americans, especially those who are low income, have limited English proficiency, are more likely to experience disparity in terms of communication with their providers. These disparities can potentially lead to unmet healthcare needs and poor quality of care. Research also found that some physicians give more information regardless of diagnostic and health issue to more adequate patients than their less educated counterparts. Studies have also shown that due to limited English proficiencies, Asian America has less to receive mental health care, cancer screening treatment, and hospice care compared with whites. Culturally, Asians are expected to show respect to authority figures. Even highly educated Asian Americans are unlikely to question medical professionals, though they may not agree with the recommendations. The fact that Asians are less likely to express their emotion may lead to providers to assume they are fine and do not have concern or questions. Patient nodding is not an indication of understanding. The doctor should ensure that they have properly communicated with the patient and the patient responds verbally in the affirmative. Provider like Dr. White should provide patients with low English proficiency with a professional interpreter services and incorporate patient families in their care. There should always be a professional interpreter present when treating immigrant patients with language barrier. Research has shown the language discordant patients report better experience with care in interpreted encounters than in non-interpreted encounters. Healthcare facilities should recruit bilingual and bilingual professionals. Providers need to respect the patient cultural basis, healthcare, and practice. The provider should be observant of patient to determine from their facial expression if they understood the instructions provided. Written demonstrations are very crucial. Written demonstrations should be used by provider to evaluate patient understanding. The limited supply of bilingual provider has led healthcare organizations to use interpreter service to bridge language gaps. Research also showed that language discordant patients report better experience with care interpreted encounters than in non-interpreted encounters. Healthcare providers like Dr. White should include patient opinion cultural competency, and language services to its clinical quality measures, and as such will provide important information to give providers opportunity for improvement. The healthcare provider should not be under any impression or assumption that a patient who has language gaps understand their care when the information was not professionally interpreted in the patient's own language. Here are the references. Thank you for listening to this discussion. Thank you.